Good afternoon. I'm Steve Selbst, the CEO and co-owner of Healthcents Inc. I've been a healthcare consultant for about 15 years and have negotiated roughly 10,000 payer contracts for practices and various ancillary providers and medical supply companies. I will be your host today and I'm looking forward to it. I will also be assisted by my colleague and Healthcents Executive Account Manager, Nicole Medina. Nicole will be your Q&A host as well, and she will be fielding questions both live as well as over the internet. I am pleased to welcome you to today's session, which is titled, Give Yourself a Raise, How to Maximize Reimbursements After the Ink is Dry on Your Payer Contracts, which will be presented by my good friends and our Healthcents business partners from Healthcare Practice Partners, Ms. Martha Sutton and Ms. Barbara Hendon. Today's session will focus on how to maximize revenues once the ink is dry on your payer contracts, and this is a perfect supplement to a session that we had last month, which focused on how to maximize reimbursements on your payer contracts. Today's speakers will discuss the importance of having a complete revenue cycle management system that effectively and efficiently enhances profitability for your practice or company. Our two guest speakers, Martha and Barbara, are the founders of Healthcare Practice Partners, also known as hcpp. They bring over 50 years of combined healthcare management experience to deliver revenue to their clients, which are all medical providers. HCPP works with their clients to develop business plans, revenue and cash flow targets, and the measurement and tracking tools that are necessary to achieve results. Their fundamental belief is that the execution and consistent monitoring of business processes is the key to successful revenue enhancement. After all, if you can't measure it, how do you know if it's working? HCCP aligns people with systems with operations to produce exceptional results. Their company offers a suite of services, including practice evaluations, analysis, and advanced revenue planning as part of the revenue cycle management program. Martha and Barbara focus on the revenue cycle plan for their clients to help them achieve a financially healthy company and or practice. This business strategy is exceptionally important in today's climate as government payers change payment methodologies to incentive-based plans. And we're going to be talking a little bit about how those incentive-based plans are going to affect your contracts when that ink is dry. I am absolutely delighted to welcome both Barbara and Martha, my good friends and our excellent partners from HCCP, as our guest speakers to this month's Healthcents webinar. Before we begin, though, I have a couple of administrative items that I would like to cover with you. First, for questions that you would like to ask during the presentation, beginning right now, you may at any time from your favorite device, a desktop computer, a Mac, a mobile device, you name it, Android, iOS, we are platform agnostic around here. You may send an email to question@healthcents.com, and we will be monitoring those questions, and during breaks, Nicole will ask your questions for you if you prefer that method of asking a question. So feel free, as you think of those questions, to please send them off, and that will help enhance the session and create an opportunity for some interaction. We will also provide the opportunity during the presentation for you to ask live questions if you choose that mechanism. And I will remind you how to do this, but when we get to that point, you will simply press *6 on your phone, ask your question, converse with the presenters, and then when you're done, press *6 again, and that will silence the line. So 2 ways to ask your questions. Also, if you lose any participation in the session, simply go to join.me/Healthcents from any web browser, and you'll be restored, as well as, of course, you can dial back into the conference line at any time as well. And one of the most common questions we get at the beginning of sessions or during a session is, how do I get copies of this material? The answer to that question is, following this session, you'll be able at any time to go to healthcents.com/copies to request a copy, and you will get an immediate copy PDF version of this presentation. And as soon as the recording of this session is completed, at that same location, healthcents.com/copies, you will also be able to get a complete copy of the recorded version of this session as well. So, without further ado, it is my pleasure to introduce Barbara Hendon and Martha Sutton. Barbara, take it away.
Thank you, Steve. We really appreciate the opportunity to share some of our experiences and ideas on how healthcare businesses and practices can maximize their reimbursement. So we'll be sharing a lot of information today, but let's first start by telling you a little bit about Healthcare Practice Partners. We're a business and practice management organization with a blend of expertise in reimbursement, business, and clinical patient care. The goal of HCPP is to provide our clients with sound and efficient planned practice management to help their business financially thrive in today's rapidly changing, challenging, and highly competitive healthcare environment. So a little bit about Martha and myself. We're the founders of HCPP, and we're going to tag team throughout this webinar today, but it should be easy to tell us apart. I'm the one with the gray hair here and the Texas accent.
And I'm Martha Sutton.
So Martha and I have been providing quality health care services for over 30 years. We've been fortunate enough to have helped thousands of patients get well and improve their health. And then early in our careers, we did that through direct patient care as clinicians. And then we got our business degrees, and now we do it through business management for our clients so they can do what they do best, and that's provide quality patient care. With our background in both clinical and business, we know how to pair quality patient care with profitable business. So who are our clients? Well, really includes anyone who files a Medicare Part B claim. And as you can see, we have a diverse experience with many providers and many different healthcare services. But today we're going to talk about and focus on maximizing reimbursement, which requires an entire economic system that surrounds both the office cash flow and the revenue cycle. When this system is implemented as a business process, it is more economically sound in the aggregate than any isolated event. So what does that mean? Well, a wheel will collapse if any one of the spokes is weak. So here is our revenue cycle wheel, and every spoke or element needs to be strong in order to have a sturdy economic system for your business or your practice. Today we're going to touch on each one of these elements and how they all form the aggregate process. So we're going to start here, where it says start here, and we're going to move clockwise around the revenue cycle. So we're going to start with the economic plan. So what is an economic plan? It's really just a map or a plan that you follow to get to your destination or your goal. Every business should have a plan, and in healthcare, your plan should really be to service patients, account for the receivables, collecting on those receivables, and it should be implemented as a business process within your organization. A good plan will help you streamline your workflow and maximize your profits by about 10 to 15% by improving internal processes, which simultaneously will improve your compliance to bolster incoming revenue. So how do you build that plan? Well, you typically start by defining your goals. What services do you want to provide? How much money do you want to make? And what is realistic? So make sure that the services that you provide match up with the amount of money that you want to make in your practice. And those services, you need to know those very well. and make sure that you know the capital outlay and the personnel requirements needed to perform those services. Also, you need to develop your pricing for your services, what you're going to offer. Make sure that your retail price or your charge price is about 2 to 2.5 above Medicare rate. Most payer contracts state that they will pay either contracted rates or your charge price, whichever is lower. So you want to make sure your pricing is adequate. Also, know what you don't know. Weakness in the revenue cycle wheel can be outsourced to an expert. We see many businesses waste time and money hoping they have the internal resources to perform every single element on that revenue cycle wheel, but then they end up with their wheel becoming wobbly or collapsing. So feel free to outsource whenever you run across something that you don't know very well. Also, I really, really like this quote here. It's give me 6 hours to chop down a tree, and I will take the first 4 to sharpen my axe. So as a business owner or as a business manager, you need to take the time to sharpen the axe of your business and formulate your economic plan, and it will make executing the tasks just that much easier. So our reimbursement tip for an economic plan is to know how much money you want to make and have a plan on how to get there. Now I'm going to hand the baton over to Martha.
Thank you, Barbara. Now that you've developed your key service points by working through your economic plan, you want to get paid the most you can for the services. So how will you do it? By securing the best paying contracts possible. And securing contracts with third-party payers is one of those revenue cycle elements that's best left to the experts. By working with experts, it'll help you ensure you receive the best reimbursement possible. You can do a lot to help your experts help you by providing them with information such as communicating who pays for your services. Some payers may pay and some may not. Commercial payers may pay and traditional Medicare may not. But some Medicare Advantage plans may choose to pay for your services if you can show them why they should. Also, it's important to analyze your CPT codes by frequency of use. Then solidify your top 10 to 20 list. You'll want to receive the most you can on those codes, so know what they are. If you have more than one business entity, make sure you contract with the appropriate one. It seems obvious, but more mistakes than you realize occur with this point. Be able to describe what's unique about your services. Know what sets you apart from your competitors. Does your staff have special skills or training that's unique? What's your geographic location, and do you care for patients in a medically underserved area? All of these points may get you higher reimbursement rates. Just be sure to let your experts know about them. Our reimbursement tip for contracting is to hire the experts. You have a great partner with Healthcents. Barbara and I have been contracting and have many years of experience in contract negotiations, and we hire Healthcents to do the contracting for our clients. It's really important to consider hiring the experts. So now that you have a nice new shiny contract, there are many steps that need to occur before you submit claims. 1, know your effective date. Make sure your practice or business demographic information is correct. You must identify all possible billing and rendering providers up front. Then double check that all billing providers' names are spelled correctly and their NPI numbers are correct with the NPI registry. Verify all your provider credentialing has been approved by the payer long before your effective date begins. 2, this is where it can get tricky. Large health plans have several product lines and many computer systems within their organization. They link your demographic and billing information with your contracted rates throughout their systems. Get a date when this upload will be finished, and it should be at least 2 weeks before your effective date. Many plans outsource data uploading functions overseas. So be sure to ask your provider rep to confirm in writing that your business information has been uploaded. Confirm that the payer has verified and tested it before you begin transmitting large volumes of claims. 3. Send small test batches of claims after the contract's effective date on each of your providers. Send maybe 10 to 20 claims on as many product lines as possible if you can. Make sure all your test claims are paid correctly before you release the remaining claims. Follow up rigorously on any claim that was not paid correct. Be sure the payer fixes the problem before submitting more claims. It's very difficult and very costly to recover large numbers of incorrectly paid claims. I cannot stress this enough, that it's very difficult to recover large numbers of incorrectly paid claims. You might need to be financially prepared for a lag in receiving payments because it could affect your cash flow. One of our clients had a massive problem with not receiving their new rates, but only on some billing providers and only on some product lines. So beware and do your own testing. From this slide, you can see that there are more than 30 different product lines within United Healthcare of Arizona alone. There's a lot of opportunity for computer glitches within payers. That's why testing is important. Remember, test and monitor small batches initially before you submit a large volume. That way you can identify and fix an issue fast. We've now completed the first 3 business elements of the revenue cycle wheel. Let's get some patients scheduled, shall we? You should have a well-developed system to track appointments by type of visit and create an appointment reminder workflow for patient reminder calls. So what should you tell patients when you call them? This is a good time to deliver necessary information before you see them. The obvious ones are their appointment time. What type of visit will it be, like maybe a CPAP clinic follow-up. If you're a specialist, you might want them to bring a current medication list. Also ask for current insurance information. But the most important and not so obvious is to ask the patients to be prepared to pay their copay or any outstanding balance. We'll talk more about this later in the presentation. Now that you have a full schedule, every appointment must have a claim. Use your discrepancy or visits without claims or visit without encounters reports for tracking this. Every system has this type of tracking option. Between 4 and 5% of all patient encounters are never billed, and the majority of these lost charges are from visits that are not completed due to charting, hospital visits, or special programs like the chronic care management, or other encounters outside of the office. Diligently logging all appointments both in and out of the offices and facilities creates a tracking method to account for all encounters. By using a combination of processes and technology, a practice should be able to account for 100% of all patient encounters in all service locations and bill all related charges. What's your no-show policy? Every practice should have a no-show charge and have the policy signed by every new patient and updated annually by every patient. Have short wait times for new patient appointments. If you have longer than a 3-week waiting list for new patients, you should look at bringing on another provider or opening more appointment times for new patients. You don't want to lose new patients to other providers or practices or companies. Every practice we work with overlooks this step, so keep an eye on your new patient wait times. Industry experts indicate that an average practice without a closed scheduling system loses between 4 and 5% of billable charges by never submitting a claim. Don't be one of them. The reimbursement tip for scheduling is to fill your schedule. Holes in your schedule is lost revenue. The time you spend developing your processes and workflows in this element will ensure you have the right to be paid for more than 98% of your claims before you ever provide services to patients. This is really, really important. Why guess if you'll be paid if you don't have to? And it all starts with verifying patient information. You need to verify that every patient's demographic and insurance information is correct. There are several ways you can do this through your software and payer portals. It's not hard to do, but it can be time-consuming, and a lot of practices and companies skip this step. Knowing this information before you see a patient is invaluable. It's the difference between getting paid and not getting paid. And there really is no excuse for not verifying this information today with all the electronic resources available. Be sure you know which services you offer that require authorization according to your contract. When in doubt, call for authorization and never leave it up to the patient to tell you if their insurance will pay. Patients rely on you to know this information. Why take the chance you won't be paid? Patients also need to know what they will owe for their care. It's essential to have a good procedure in place to determine how much your patients will owe at the time services are rendered. This amount could be a copayment, a cost share, a deductible, or all three. Or the patients could have a previous balance due. Having accurate information regarding the patient's financial obligations will allow your staff to notify the patients in advance of the appointment. This can be done during the appointment reminder calls. We have helped script and train front office personnel to say something like, "Hello, Mr. Jones. You have an appointment tomorrow with Dr. Green. Be sure to bring your current medication list and insurance card, and your copay for this visit will be $50. You also have a previous balance of $25 for a total due of $75. Will you be prepared to pay this when you check in? If so, great. If not, we can reschedule your appointment for another time, or we can help you set up a payment plan." Communicating patients' payment obligation is a downfall with many of our clients when we first start to work with them. Your front office staff must feel comfortable asking for payment, and you must have a good training process and policies in place to make sure your staff sticks to it. Policies and procedures for these key components will help you reduce your accounts receivable. It will improve communications among staff members, billing and front office, and for your patients. It also sets a professional tone and communicates the payment's expectations for your practice or business. Don't be timid about asking for payments from patients. The good news is you really have the power to know that you will be paid and how much to expect before you ever see a patient by following the key components of this reimbursement tip. You're ready now to see patients. So I'll turn the presentation back to Barbara.
All right, thanks, Mari. Okay, so now we're ready to see a patient. So having check-in policies and procedures will help produce a highly functioning and productive front office where each employee should be operating the same. We've run across many clients or many offices that have numerous front office staff. Some will collect a copay, some won't collect a copay. So it's really essential that you have procedures where every employee is operating the same. And now that your patient knows in advance what their portion is or their obligation, they should be prepared to pay some or all of it depending on whatever arrangements have been made ahead of time. So make sure you hold them to that obligation or reschedule their appointment. Also know what type of visit this is. Is it a problem visit or a wellness visit? You can use this visit. Can you use this visit to enroll them in other wellness initiatives or screening, which we'll talk about later? Or maybe it's a well visit, but they present with a problem. So it's important to know how to code for a wellness visit when they present a problem, because you can get paid for that without rescheduling the patient to come in at another time, which might be inconvenient for the patient. Also, maximize all your services during the visit. Medicare now allows payment for having discussions with your patients on advance directives or enrolling them into chronic care programs or having consultations for certain screening. So use the opportunity and maximize your services during the visit. So our reimbursement tip is to collect patient obligation at the window. This will significantly reduce your patient AR. Now we're going to talk about follow-up and recalls. Having guidelines for when your patient should return for a follow-up visit is really essential. Besides good clinical judgment, you can use best practices or clinical practice guidelines to develop follow-up schedules for your patients. Don't leave it up to the patient to decide when to return. You know, I had a friend of mine tell me that she went with her dad to see the cardiologist for his CHF, and she said, "When should my dad come back to see you?" And the doctor said, "Well, whenever he feels like he needs to come back and see me." And she said, "Well, if it's up to him, he'll never come back." So she was really looking for the physician to let her know when a good follow-up time would be for her father. And so that's really important to make sure that you have a way to have guidelines for follow-up visits. Also have recall policies for when patients are due for their annual Medicare wellness exams or when they should come back in for annual screenings or have supply replacements. Those are also good opportunities to call patients back in or to go see them again. So here's an example of a clinical practice guideline from the National Institute of Health for asthma monitoring. And as you can see from the slide, the follow-up recommendation based on these guidelines for asthma is to see the doctor every 2 to 6 weeks while gaining control of their asthma, every 1 to 6 months to monitor their control, every 3 months if therapy step down is anticipated. Also notice here that the recommendation is to have pulmonary function study every 1 to 2 years or more frequently if not controlled. So this would be a good recall initiative for those patients with asthma or even COPD who have not had a spirometry in over 1 to 2 years. And it's also a good opportunity or a good reference for a follow-up schedule or a follow-up guide. There are also guidelines from the Office of the Inspector General on replacement for some DME supplies, as you can see here. So these are a couple of good examples on resources you can use to develop your follow-up schedule. So the reimbursement tip is to have a plan or a follow-up plan or a follow-up guide for your patients on when they should return to see the provider or have their equipment replaced. You can certainly fill your schedule if you have a proactive initiative for recalls, and your business will be operating according to best practices. So now let's talk about documentation. If you don't document it, you didn't do it, and you can't charge for it. We see so many lost charges because healthcare providers don't document all that they do. So do what you document what you do. Your documentation should match what you do for your patient. Documentation should also be concise and limited only to that information necessary for decision-making and medical necessity. Don't clone your documentation. You can use templates and smart forms, but you need to be careful that you're not cloning from one visit to the next. Cloning is considered a misrepresentation of the medical necessity requirement for coverage of services. Also, don't over-document. Volume is not the primary influence upon which a specific level of service is billed. Medical necessity is, and in addition to an individual requirements of a CPT code. So avoid any kind of clutter in your documentation. Also, correct documentation produces accurate coding, accurate claims, and accurate payments. So here's a missed opportunity that we ran across for one of our clients. We had a physician who said he was having regular conversations with his patients about living wills and advance directives, but he never was documenting it. So we showed him that Medicare does pay for advanced care planning. So this is just one example of missed documentation. So the reimbursement tip is documentation should be concise and limited. So in this case, more is not better, and that should save your providers time. All right, so we've covered the first three elements of the business process and also the section on patient care. So we're going to get now into some of the reimbursement components of the revenue cycle elements, and Martha's going to cover the next few items.
So let's talk about coding. Why do we do it and why it's important? So coding is the numerical expression of what, why, and how care is delivered. Coding quantifies for billing purposes what's contained in the clinical chart or patient record. And codes must reflect the same level of care noted in that chart or record. If you fail to match the clinical documentation to the billing codes for both the diagnosis and services, it can result in lost charges or even overbilling. All medical procedures, diagnoses, and supplies are identified by codes. They explain what was done for the patient, and they shorten and streamline the revenue cycle from treatment to payment. You should develop oversight procedures by coding experts to review charges before claims are transmitted. Downcoding is a common and expensive problem. It's the practice of deliberately selecting a billing code that is lower than the services rendered. Many providers tend to be cautious with their coding out of fear of being audited, and they use a lower billing code instead of billing at the appropriate level. Apprehension about potential audits and repayments should not cause providers to get conservative in their coding. It merely means you need to understand and adhere to the coding rules. The basic coding requirement is that the diagnosis must justify the procedure or service. A provider can be paid for his or her services if they document there was a medically justifiable reason for performing the service and coding to that reason. A study published in Medical Economics magazine stated downcoding can cost a single doctor $40,000 in lost revenue each year. So, bottom line, just don't do it. While you're coding, keep in mind the basic requirement that the diagnosis must justify the procedure or service, and you will most likely always be paid. Now let's talk about getting your claims out the door so that you can get paid. This element gathers the claims after coding and transmits them to the payer so that they can get payment to you. I'm sure everyone knows this, but the goal here is to make sure the claims arrive at the payer and in a condition to be paid correctly without human intervention. And that's not easy to do, is it? Be careful with this element. The claims generation and transmission process is so automated today that it becomes easy to ignore problems until you have a backup in AR. After you generate a code and create a claim, it should pass through several edits in your software. Basic software edits can check demographics like birth dates, zip codes, and basic insurance ID numbers, such as Medicare numbers with no letter after the name. Then there are more advanced editing software tools available that will perform a higher level of checking claims, such as matching diagnosis with procedures or services. Make sure you take advantage of these software editing tools. Once your claims have been edited, they are ready to transmit to payers. Transmission reports are important at this stage because they show you the electronic pathways your claims are traveling down. Reports can show you if the claims were received, and in some cases, if they are ready to be paid. Following the transmission reports is the most important part of generating claims to ensure fast payment. All payers expect that you will send them claims after patients are treated in a timely manner. Know what your contracts say about timely filing. If you miss the deadline, you will not be paid, period. All payers have different deadlines, so know your deadlines and do not miss them. If you want to get paid correctly, code it right. If you want to get paid quick, monitor the transmission reports. The reimbursement tip is to look at your transmission reports and develop workflows to monitor and correct claims that have stalled or have been rejected as soon as they occur. If you follow this reimbursement tip, you'll have plenty of payments to post. So let's talk about payment posting next. This is another automated process that causes lost revenue if not watched closely. Most organizations electronically post payments and accept the auto-calculated adjustments. Recently, HCPP recovered over $200,000 in underpaid claims for one client due to auto-posting errors. The auto-posting process accepted the payments and adjustments and then automatically closed or finalized the claim. Because the claims were closed, it appeared the claims were paid correctly. Inappropriate adjustments can be done both electronically and manually. So make sure you have a fail-safe plan in place to check under and overpaid claims. Your posters need to be trained to watch this closely. Many practices fail at this point. Be sure you understand how your system alerts posters to fee schedule mismatches. Your clearinghouse can help with this as well as your software, so investigate your tracking options. Most software require an upload of your fee schedules annually to take advantage of mismatch alert options. Don't forget to have this step assigned to someone as you develop your internal processes. You must have a process for reviewing each payment to determine if the claim has a credit balance to either a patient or a payer. What's your follow-up process for claims that have paid zero? And ask yourself if you have the appropriate staff monitoring these processes. There are lots of reasons that claims pay zero. Make sure your staff is trained to know them and don't just write them off. Overpayment is becoming more and more important today, and as of March 2016, Medicare expects all providers receiving Medicare payments to scrub their books, going back as far as 6 years, and repaying every overpayment they can find, even those that resulted from the payer's own mistakes. When an overpayment happens, providers are expected to actively investigate the claim and pay the money back. There are stiff penalties for those who don't follow this rule. So the reimbursement tip here is to spend the extra time and check your numbers. It can really increase your top line. It can also reduce your AR. If the elements in purple on this slide are performed accurately and in aggregate, there should be minimal AR past 60 days. Here's a question for you. Do you know the usual time it takes for your payers to pay you? And do you know the time frame your contract says the payers have to pay you? Medicare typically pays in 21 days. United Healthcare typically pays in about 10 days. Aetna will adjudicate or pay most claims in about 8 days, but they won't release the funds for about 2 weeks. Watch your submitted claims and know your usual paid timeframes. When claims are not paid within the timeframes, get on the phone and find out why not. When we do this, the most common response we hear is there's no claim on file. I'm sure everybody has heard that. Have your transmission reports ready before you call so you'll know when the payer received the claim. Remember, the payers do make mistakes. They do upgrade their computers all the time. And because of this, it could be a computer glitch on the payer side. So be watching for no claim on file being a problem of the payers. If you touch a claim more than once, it costs your business money. So expect the payer to fix a problem and pay the claim fast. At our organization, one of our famous sayings is, "May I speak to your supervisor?" Getting a supervisor involved gets the problem solved fast most times. You can also call the payer's EDI department and ask for the claim acceptance data. When you are doing AR follow-up, your attitude should be, we checked eligibility, we obtained an authorization when we needed to, and we performed the services in good faith. Now we expect you, Mr. Payer, to pay us. And have that attitude from both payer and patients. You should not have patient AR greater than 90 days in your system that does not have a payment arrangement of some kind. Your payment policy should include a minimum payment acceptance, such as asking the patients to pay half now and then make payments of $50 a month. And all unaccounted for patient AR greater than 90 days should be headed to a collection agency without exception. Some unprofessional billing companies play the numbers game. They bill out as much as they can and collect the easy dollars, or what we call the low-hanging fruit. Professional billing companies will get out their ladder and collect all of the fruit. Make sure that you have a plan to collect all the dollars due to your business. At this point, Steve, I think it'll be a good time to take a quick break and ask if there are any questions.
Terrific. And let me remind the audience, there are two ways to ask questions. First, I will unmute the line so that you may ask your question. And this means that if you would like to ask a live question, at this time, please press *6 on your phone and ask your question. So again, press *6 and please ask any live questions. I will pause for live questions. *6. I think I hear somebody maybe trying. Did somebody just press *6 and have a live question? Maybe not. Maybe that was Morse code. In any event, a question came in a little while ago, and I just want to remind, the question was about how do I get copies of these slides? And the way you do that is after the session, you go to healthcents.com/copies, and you'll get a complete PDF copy of the session. And in the next 24 hours or so, you'll also have the opportunity to get a complete recorded version of this session. Let me pass the baton over to my colleague and the Healthcents Director of Account Management, Nicole Medina. And Nicole, do we have any questions that may have come in on the internet at question@healthcents.com?
Yes, Steve, thank you. We actually do have a question that came through. Martha and Barbara, the question is, how long would it take to develop and implement an entire economic plan?
Okay, Nicole, thanks. Well, it really depends on the business or the practice. You know, we've been into some practices that it can be done fairly quickly, I would say within probably 6 months. And others, some of the larger practices, are just depending on where they are, how, I don't really want to use the word messed up. They're really
Unorganized.
Unorganized their practice is. It can take up to 16 months. So it really varies depending on the condition of the business or the practice.
Okay, very good.
Great.
Are there any others at this point?
At this point, Steve, no, there's not.
Okay, terrific. Then I remind the audience that you may continue to send your questions to question, without an S, at healthcents.com. And I will pass the baton back over to our presenters, Barbara and Martha.
Okay, thanks, Steve and Nicole. So this is Barb, and I'm going to continue on around the revenue cycle wheel. We're now going to talk about an economic compliance program. What an economics compliance program is to ensure that every process we've talked about to this point is being complied with, or there's compliance within the practice or the business. And each business should have an internal control system that ensures compliance with all your policies and procedures associated with your services, and especially your revenue collection. So are these policies being followed at the front desk? Are patient payments being collected and entered into the system correctly? Are eligibility and authorizations being done? And so we know that we have the right to be paid. Are those services being translated through documentation and claim creation? And are the claims follow-up procedures being followed? And are your payers paying according to contract? So having internal control systems to check all those points is really important. It also helps you identify issues before they become significant problems. It can help identify procedures that aren't working or system or human errors. For the one client that Martha mentioned earlier about the underpaid claims, that we uncovered about $200,000 worth of underpaid claims, that had been going on for over 2 years, and no one noticed it or identified it. So we were able to get the payer to write a check to the practice for that amount until they resolved the underpaid claims, claim by claim. So when you find an issue, your corrective action may be to change your policy or your procedure. Maybe you need to hire a new person, or maybe you need to retrain or outsource to an expert. If you need to do retraining, make sure that you document the retraining, and you also document which employees needed to be retrained. And what type of dashboard reports or tools do you need to track if you're on target with your plan, or that all the elements of your wheel are working and they're strong and doing what they're supposed to do. So here's just a quick example of an internal compliance tool that we developed for one of our Texas cardiology clients who wanted to monitor his staff's productivity in his testing lab. So he uses this tool to check on productivity and revenue on a weekly and a monthly basis. So the reimbursement tip is to have an economic compliance program so you can monitor where you are to your plan and make your adjustments as needed. So now we've been through all these elements of the wheel individually, but you can see how they're all interconnected, and they must function in aggregate to get optimal results. Your compliance program will also help you see that you're getting these maximum results. So a lot of people ask, how do I monitor and measure for compliance? Well, you typically do that through data. So we're going to keep going, and we're going to talk about data. Data is the key to knowledge on how your business is doing, and you have to be able to rely on your data for measuring, monitoring, and reporting. Your data must be accurate and protected, sometimes protected from your own staff of making changes in your system that could inadvertently affect the data. Many organizations don't have a good management protocol for their data, so it ends up being corrupted or unreliable, and then reports can't be trusted. So have somebody within your practice or your business who's a data ambassador, or someone who can help you manage and protect the data in your system. The ambassador could also be your super user, somebody who knows your system very well, knows how to maneuver within the system, or you could hire an expert. Just have someone who can help design data policies and that know if you change one single little thing within your system, how it will affect the output of that information in reporting. Plus, in the future, accurate and reliable data will be essential to survive and for your future reimbursement. So don't forget, if you put garbage into your system, you're only going to get garbage out. So it's really important that you manage your data very well. So the tip is to ensure data quality and integrity so it can be trusted when you get the information back out of your system. It will also help you proactively identify patients for your recall programs such as wellness and prevention, which we're going to talk about next. So in the 1990s, managed care organizations put wellness programs into place, and they called them disease management. And in just the past several years, Medicare has realized that being proactive instead of reactive in patient care has its significant benefits. So now Medicare is reimbursing for wellness and prevention programs like chronic care management, transitional care management, annual wellness visits, and more types of prevention screenings. So you should identify programs or screenings that could augment your services, or in some cases that you may already be doing, just not documenting it or charging for it. So look for programs that fit your economic plan and your service offerings. For example, any primary care provider can get paid by Medicare for having a lung cancer screening consultation with patients who meet criteria for the CAT scan screening. So understand the rules and reimbursement and the criteria for enrollment into these programs. Also, you can identify patients through data mining. Many people in your current base of patients will meet criteria for wellness and prevention initiatives. So be proactive and use your data to find them. And this is routinely missed opportunity in many of the practices we go into because they don't dedicate a staff member to identify these patients and recall them for these programs. These programs are also good to help you fulfill your quality initiatives. So the reimbursement tip is to have a dedicated person for these initiatives if you possibly can. One of our Georgia clients, who is 22 providers, had a dedicated wellness nurse, but they ended up pulling her to work in another area for a couple of months, and the practice actually experienced a 14% drop in patient appointments while she was dedicated to working in another area. So having someone dedicated to identify and recall patients in for wellness and prevention is a really good way to fill your schedule. So now we're going to talk about quality initiatives, and they are typically, quality initiatives include defined tools that help measure healthcare processes, outcomes, and patient perception, such as satisfaction, and that are now associated with the ability to provide high-quality services and how that relates to one or more quality goals. Now, these goals typically include effective, safe, efficient, patient-centered, equitable, and timely care. So it's a lot of goals that they're looking for these initiatives to address. So know your own requirements and quality measures to meet the standards and regulatory requirements or accreditation for your own industry. And these quality initiatives are having more and more impact on how providers are getting paid. So Martha's going to talk a little bit more about the relationship between quality and pay.
Thanks, Barb. So the buzzword today, MIPS, MACRA. What is it? What does it mean? And so let's talk real high level about this at this point. So pay for performance. President Obama signed into law the Medicare Access and CHIP Reauthorization Act, MACRA, on April 16, 2015. MACRA replaces the current Medicare reimbursement schedule with a new pay-for-performance program that's focused on quality, value, and accountability. Now, MACRA is going to combine parts of PQRS, the value-based modifier, and the meaningful use incentive program, and roll it into one single program called the Merit-Based Incentive Payment System, or MIPS. The Merit-Based Incentive Payment System is the name of a new program that will determine Medicare payment adjustments using a composite performance score. Eligible professionals may receive a payment bonus, a payment penalty, or no payment adjustment at all. The composite performance score is based on 4 performance categories: quality, resource use, clinical practice improvement activities, advancing care information, or the old meaningful use. And the weights are on the slide below. Performance measures for MIPS will start on January 1st, 2017, and will annually measure eligible providers in 4 performance categories to derive a MIPS score between 0 to 100. The MIPS score can significantly impact a provider's Medicare reimbursement in each payment year, from -9 to a +9 from the baseline. MACRAS intends to enact a new payment framework that rewards healthcare providers for giving better care instead of more service. The final rule was just released last Friday, October the 14th, and information regarding this may be reviewed in the Quality Payment Program on the CMS website. This is another area where hiring an expert can really pay off. As you can see from this slide, that if you participate in the pay for performance programs, you can really give yourself a raise. Don't wait too long to get started. 2017 is just around the corner. We've talked with several providers who chose not to participate in meaningful use, and they are now suffering the reimbursement penalties. So please, 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 going forward, don't live under a rock. Participate in these programs. It will help you increase revenue and increase your profits, and get and ask for the help that's available to you from your experts. Everything we've talked about to this point focuses on your top line revenue. Most of the revenue improvement discussions should not require additional staff unless you need to expand or hire a wellness coordinator. But in order to give yourself a raise, you must take into account your expenses. Running an efficient, productive practice will streamline operations and reduce expenses and flow more money into your profit margin. A practice that embraces economic plans as normal and expected actions will experience a more efficient, more profitable, and a more economically viable business entity. So we've now completed the revenue cycle elements wheel. Every spoke of the wheel plays an important part in the success of your business. So the bottom line is this: by developing a plan, executing that plan, and monitoring your plan, you can expect to increase your reimbursement, reduce your expenses, improve net profits, and give yourself a raise, all before and after the ink is dry on your new payer contract. Steve, I think that's time for questions.
Okay, terrific. Let me pause right here for any additional live questions, and remind the audience that you may ask a live question right now at this time by pressing *6 on your phone. So I will pause. Any questions? *6, please. Okay, then before our wrap up and summary, I will ask Nicole Medina if we have any questions that came in over the internet. Nicole?
Hi, Steve. Yes, we did have one more question that came through. Martha and Barbara, it's how can I tell if payers are paying according to contracted rates?
That's a very good question. I'm glad someone asked that question. That's one way is to know your system alerts. What is your system capable of monitoring and measuring for you? You'll have to upload your new payer contract rates into some sort of system that can combine or compare what you are paid with what you're supposed to be paid. And you can pull a lot of that information from your clearinghouses, but that's a real important process to investigate, and each software system has something different. I hope that answered the question.
Yes, thank you very much, Martha. And also on that point, it is a good idea in any of your billing systems to load in your contracted rates so that you can compare the total amount of the EOB at 100%, including patient co-payments, to ensure accuracy of payment. And at this time, I would like to do a couple of things. First, I would like very much to thank our distinguished presenters, Barbara Hendon and Martha Sutton of Healthcare Practice Partners, for sharing their expertise in this session and doing it in such a practical way by taking us all the way around 360 degrees through the revenue cycle. So our thanks to you both, Barbara and Martha, for a job well done and a lot of valuable information shared with all of our providers today. Thank you.
Thank you. Thank you, Steve.
In addition, I would like to offer to those attending a free contracts assessment with my colleague and partner, Susan Charkin. All you need to do is send her an email or phone her at the number provided if you would like to have a no-cost, no-obligation discussion. And we have had many clients and customers that have taken advantage of this 1 hour session, some of who have become customers of Healthcents, some who haven't, but all of who have benefited from this discussion. She will share her 30-plus years of expertise with you, so I encourage you to take advantage of that opportunity. In addition, you may at any time send an email to info@healthcents.com as indicated above here, or phone our 800 number at 800-497-4970, including questions for our partners here, Barbara and Martha at hcpp. You can simply use that same email, and we'll be happy to get you fast answers. So with that, shortly after the first of the year, I expect that we will be conducting a subsequent webinar on the topic of how to get contracted into closed or narrow networks. For those of you attending MedTrade, we also have a session there coming up at the end of the month, 1st of November actually, on that very topic. So with that brings us to the top of the hour and to a close. So this will end today's webinar. Thank you all for your participation and have a great afternoon.